call the meeting to order of August 16th of the Community and Public Health Committee.
Great, and I will call roll. My name is Mark Morowitz. I'm the Health Commission Secretary. Commissioner Gerardo.
Here.
And Commissioner Chung.
Here.
Great, and I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community, and by affirming their sovereign rights as First Peoples. We can move on to the second item, which is the approval of the July 19th, 2022 committee minutes.
I so approve the July committee minutes.
And I second.
And with just two of you attending, then that action leads to approval. So thank you. And there's no public on the line to check for public comment. So we can move on to item 3, the Center for Public Health Research Shine Strong program.
Hi everyone, I'm gonna see if I can start my video. It is a pleasure to be with you all. Okay, I'm Sean Arreas-Ricol, and I go ahead and I will be presenting today on behalf of the Center for Public Health Research. I have a slide deck that I will go ahead and use to navigate us through this presentation. I will share that now. Can you all see that?
Looks great.
Awesome. Thank you, everyone. It's really a pleasure to be here with you all and to share a little bit about our Shine Strong program. I will go ahead and move through these slides, however which way you all feel comfortable asking questions during. Please interrupt me, or we can go ahead and pause for questions at the end. I am a senior research scientist at the Center for Public Health Research, also faculty at the University of California, San Francisco in the Department of Epidemiology and Biostatistics. And I am here to talk to you about the Shine Strong program. And on my opening slide, I have a really provocative photo here. It's artwork by Juniper Yoon, and her credit information is listed in the bottom right corner. And so, if you aren't familiar with the Center for Public Health Research, we are a group of investigators and researchers and epidemiologists. I'll go into that a little bit more in a bit. But we really see ourselves as a hub for innovation in public health science, striving to protect and promote the health of all San Franciscans. Just in a few bullets to describe the work that we do, a lot of our work, in the evolution of 25NS. We once were, when the AIDS office was the AIDS office, we once were a part of that, and a lot of our work has reorganized and also still keeps that thread and that focus on serving and meeting the needs of those infected and affected with HIV. And so a lot of our work is HIV related, conducting behavioral surveillance with priority populations, men who have sex with men, trans women, people who inject drugs, as well as women who engage in sex work, as well as high-risk heterosexuals. And this is all under the umbrella of the National HIV Behavioral Surveillance Study that the CDC runs in its sentinel surveillance efforts across the country. We also conduct a lot of community-engaged research, and I will not talk about all of our projects at length, but I will say that that community-engaged research is really at the core of how we engage, even asking questions and also designing research that meets the needs of San Franciscans. We also conduct a lot of social epidemiologic studies, thinking about health broadly, not just thinking about identifying the prevalence of particular diseases or in disease areas. We also look at mental health, we examine social determinants in and around various health issues, as well as conducting implementation science research. We have a current study right now that is looking at developing or exploring how we can develop a digital navigation system that interfaces with patients and populations here in San Francisco. And so at CPHR, we have a small group called TRUE, the Trans Research Unit for Equity. And this is a photo of, at least at one point in time, who we were then. And TRUE is a science community partnership whose mission is to generate knowledge and eliminate health disparities in trans and non-binary communities in San Francisco and around the globe. And CPHR is led by Drs. Willie McFarland and also Dr. Erin Wilson, CPHR and TRUE that is, and here are their photos, just in case if you need a little bit of a refresher of who they are. And so we are here to talk a little bit more about Shine Strong today. And Shine Strong is the first NIMH-funded undergraduate multidisciplinary training program in HIV prevention science and trans and non-binary health. And it is a training program, the first training program of its kind. We were first funded in 2020, and we anticipate carrying out our work through 2025. And because of the beginning of the pandemic, we hope that our work will continue into 2026. And we truly hope that this will be a program that leaves a mark in which its renewal and its continuance past this time is likely. And so the Shine Strong team is made up of various faculty and staff that bridges both UCSF as well as SFDPH. And here are their photos. I will go ahead and talk a little bit about them. We have more traditional epidemiologists like Dr. Willie McFarland, social epidemiologists like Dr. Wilson, and also social work trained psychologists like Kelly Taylor, and I myself am a medical sociologist, so really bringing in a different lens to analyze things like discrimination and power in society and how that impacts health. We also have Alex Marr, who is at UCSF, who is a PhD student, and Bo, who is at the San Francisco Health Department, who make up our data analysis team, as well as Stephanie Luz Hernandez and Dr. Sophia Kong, who make up our mental health team. And together, the faculty, the first row, as well as Alex and Bo, and our mental health team, we are the team that interfaces with all of the scholars in every cohort in which we train to build their capacity in HIV prevention science and trans and non-binary population health. We also, you may see a familiar face, we also are advised by many strong trans women, have had histories here in San Francisco in the Bay Area and are currently here as well. That includes Commissioner Cecilia Chung, also Akira Jackson, CEO of Taj's Coalition, Tiffany Woods, former program manager and director at Tri-City Health Center, who is currently now working with the State AIDS Department, Karen Aguilar, lead patient navigator at the Gender Health Program, Lexi Adsit, who is the executive director of TransCan Work in Los Angeles, and also a former master student, and also advocate and leader here in the Bay Area. And then Vanessa Wari, who is a PhD student currently at UCLA in the School of Social Work. And so our program goals are truly designed around building scholars' expertise in HIV prevention science and trans and non-binary population health. As you may know, or maybe not know, because we are in San Francisco, and and by virtue of that, we may take a lot of the true expertise and grassroots organizing for granted a bit. There is still a need for developing expertise in trans and non-binary population health within the larger umbrella of HIV prevention science. It is still very rare, and programs do not formally teach curricula and teach about trans and non-binary population health in a way that is centered in and around community. And our second goal is to support scholars' identity development as a scientist and researcher. As you all may know, your job and your careers may not be something that is easily turned off at 5 p.m. or 5:30 or 6 p.m. There is an active engagement with one's career development as a scholar, and engaging in academia does require young people, especially of many different diverse intersections of identity, to really practice envisioning who they are in academia. And so Shine Strong is a place to support that identity development as a scientist and a researcher, to ensure that these young people belong in our public health systems, also in our higher education. And our last goal is to develop the next generation of HIV and trans non-binary population health scientists. We believe that in order to grow the work, we need to have more young people familiar, as well as carrying the torch and really taking the next steps in their career, so that there is this transfer of knowledge, but also expertise, and engaging and practice and creating a science that is relevant to trans and non-binary people through involving young people at an early stage in their career. And so the program components, we're a one-year program, we're a one-year training program. It starts off with a summer intensive, so about 12 weeks, that begins with an in-person kickoff meeting here in San Francisco, followed by virtual seminars and lots of discussions over the course of those 12 weeks. During the summer intensive, there are substantive scientific seminars and discussions about PrEP, HIV, biomedical interventions, as well as community-based approaches to preventing HIV. We also explore non-communicable diseases as well. There are many quantitative seminars and labs in which scholars in every cohort learn to utilize a quantitative statistical software program called Stata, in order to analyze the data the rich data that we have in their mentored research projects. There are also legacy seminars with trans health leaders and advocates here in San Francisco. And these legacy seminars are so important because it really does the work of building a bridge between various generations of grassroots mobilization advocates. Sometimes youth today are rarely connected to those who came before them, and so these legacy seminars work to ensure that there is that link. We also support scholars to attend a scientific conference, and it just so happens that in the summer, the International AIDS Conference happens and occurs, and so scholars have attended virtually that scientific conference. And over the course of the summer, scholars work one-on-one with their mentors and other faculty to bring their mentored research projects to a conclusion. And so there's lots of ongoing meetings related to that. There's also a seminar series called Breakthrough Sessions. And in these sessions, I facilitate photo voice exercises. So exercises that ask scholars to use a camera to analyze the world around them and to make sense of the world around them. And this is really, and all of our conversations are really at the heart of teasing out and unpacking one's identity and how we fit in the academic fields, and also how we fit in as a researcher. And I mentioned before that we have a mental health team with Stephanie and Dr. Sophia Kong, and those two individuals are involved in a component of our program called soul care. And so we know that and soul care happens in a group. It's there to provide social support in a group setting, also as well as in individual settings. And I note this because while we are exploring our identity, not only as individuals, we're also trying on the hat of what it might look like to be a researcher, or what it might look like to be someone doing work or a future provider of trans and non-binary folks, and all of that can really weigh on someone. And so while we're working through many of the intricacies of what that means for young people today as scholars in the program, soul care is a space in which all of our scholars can process without fear of ramifications, and process what they're going through, what this process looks like for them, and learn about strategies around resilience and developing skills to resist some of these feelings of that being in academia can transfer or can cause for young people. And so these soul care groups are really also a cornerstone of our program as well. And again, lots of meetings with mentors over the course of the summer. And during the academic year, which occurs virtually, scholars will also continue to attend scientific seminars and discussions. There are graduate school panels, and also workshops on preparing the applications to graduate school. And we hope that in these sessions, there's networking that happens with presenters so that scholars can start to understand and maybe better visualize what a career in psychology, medicine, or social science research might look like. And once they're done with their mentored research projects during the academic year, we support scholars to submit their abstracts, so their presentation abstracts to conferences. And we hope that during this time that their presentations are accepted at national scientific conferences and then presented. In a parallel track, we also work with scholars to develop their own first authored manuscripts, so carrying their mentored research truly all the way through dissemination, and not just not just through data collection or data analysis. We really our intention is to support scholars through data analysis all the way through dissemination of their scientific peer-reviewed manuscripts. And of course, careers, as we know, careers and mentorship don't follow any pre-approved plan, right? And so beyond this year, we all also have offered scholars to provide mentorship to them until they matriculate into a graduate program of their choice. And so we know that not everyone may be on the same path with regards to their path to and through academia. And so whether that involves a gap year or two, our intention as faculty and mentors is to be there through and when scholars need us, even outside of this one-year program. And so just in short, scholars, as a result of the program, work on a mentored research project, present their work at a scientific conference, and also publish their work in a scientific manuscript. And what we hope is that all of this helps to conceptualize and concretize and move them towards pursuing a graduate program in the health sciences and contributing to HIV prevention science and trans and non-binary population health. Now, I'll talk a little bit about our scholars in cohort 1. This was our first cohort, and again, in the beginning of the pandemic, we had a smaller cohort of 3 scholars, at that point, undergraduates at UC Berkeley, and their projects are here. One project focused on HIV-related structural discrimination on mental health outcomes for trans women. Another project focused on the HIV care continuum for trans women. And our last project focused on describing the carceral system and trans women's engagement in the carceral system here in San Francisco. We're currently in our second cohort, and our second cohort has expanded a bit and also expanded in scope. They are in the midst of their summer intensive right now, finishing up the last bits of their analyses, and we have students from Stanford, Virginia Commonwealth University, Vanderbilt, UCLA, UC San Diego, and University of Wisconsin-Madison. And I'm really excited to see where their work goes next. Some of their topics, I think that a lot of the topics that cohort 2 is tackling are really awesome and really interesting and critical to understanding how we can best support the overall well-being and holistic health of trans women in San Francisco and abroad. And I will talk a little bit about those topics. We have a scholar that's looking at types of support, social support, and how that is related to substance use. We have a scholar that's looking at anti-trans stigma and relationship quality among trans women in sexual partnerships, and then another scholar looking at relationship stigma and substance use. We also have another scholar looking at determinants of intimate partner violence among trans women in San Francisco. And then we have 2 scholars who are working on a data set focused on trans men and their health in Bhutan. One scholar is looking at determinants of HIV and STI testing, and another scholar is looking at anti-trans stigma and discrimination among trans men in Bhutan. And lastly, but not least, we have a scholar that is looking at sexual health disparities among sexual minority trans women, that is, trans women who do not identify as heterosexual in San Francisco. And I'll talk a little bit about successes. We're a young program, as I said. We finished with our first cohort, first year program, and we're now in the very beginning of our second cohort. I'm happy to report that all of our cohort 1 scholars submitted abstracts to this year's International AIDS Conference, and all of them were accepted. We have 1 scholar who applied to graduate school, and at least last December, and that scholar was admitted to multiple master's programs in public health, and they will be attending the UCLA and in the MPH program in epidemiology and biostatistics. And we also have 1 scholar whose manuscript was published in the International Journal of STDs and AIDS, and that's the title there to the right. And currently all Shine Strong scholars, cohorts 1 and 2, all 10 of them are underrepresented minorities in science and medicine. And we're really proud to contribute to their development in an effort to ensure that equity across their various disciplinary interests takes a step in that direction. And I wanted to pause and just tell and kind of reflect a bit. Here is I mentioned that we engage in photo voice as a methodology to unpack the kinds of identities that we bring to academia. And in one of them, on the left, you see a photo that a scholar took, and then their narration of that photo. And I'll read that to you now. They say, "This photo is a small plate with breadcrumbs. A day after I ate toast for breakfast, I realized I forgot to put away the plate and took a picture. Trans and non-binary people are discussed in academia, and although we're given a place or a plate, we're often afterthoughts or just given crumbs, and we're told that this is all that's left." And this resonates with me so much because this speaks to the very impetus and need for Shine Strong and our program and the work that we're doing, because even though, and again, there's a lot of there's a different cultural milieu here in San Francisco with regards to the visibility of trans and non-binary communities here in San Francisco. That doesn't exist everywhere, and it doesn't exist, and it's not, and it isn't. And academia is not always a place that has space or creates space for trans and non-binary scholars. And so this photo just really spoke to me and really resonated with the purpose and the spirit of Shine Strong. So thank you. That brings our presentation to a close. I thank you. And if you have questions, please reach out to Dr. Erin Wilson or myself. And also for more information about our work, we have those links up as well. And I will go ahead and take a pause and stop sharing, and then see if we have any questions.
Commissioners, there's no one on the line for public comment, so please feel free to jump in and comment or ask questions.
I just want to thank you for this absolutely excellent presentation. Your work is just essential, and I learned a lot. And you basically answered the questions that I had submitted. And so thank you, because I was assuming the program had to be virtual, but thank you for clarifying that. But one of my other questions is, how long is your funding for through NIMH?
Yeah, it runs through 2025.
Okay, and is there the possibility of renewal or as well? I guess my concern is 2025 isn't all that far away. We're only talking like one or two more cohorts, and whether or not what the sustainability of the program is.
Absolutely. Thank you so much. That's a really important topic. And so from day one, after being notified that we were awarded this grant, we committed to really having an eye towards sustainability. And so that's why we're so invested in the personal and professional development of our scholars. And so even though this grant will end in 2025, we have every intention of applying for a renewal in the beginning of 2024, so that there isn't a gap between 2025 and 2026. And we're very obviously, I'm completely biased by saying this, but there is no other space that exists in the NIH portfolio that even comes close to a program like this. And so I am really, really enthusiastic about a renewal. And so right now, all of the work that we are focused on is really also is focused on having our scholars have the best experience possible, but also about outcomes related to successfully procuring a renewal.
Great. My fingers are crossed. What was the date of the original grant?
Yeah, it was funded in 2020, I believe August 1st, 2020.
Okay. I'm just looking at hopefully no other political implications for renewal.
Yeah, that's really important to consider, right? And I think that one of the at least in terms of enthusiasm at the institute level, there's a lot of support and enthusiasm and at the institute level at NIMH. So if that can kind of have us rest assured a little bit, but yes, that's a really important factor as well.
Great. Well, thank you so much again. That was, I guess, my concern is the sustainability of the excellent work. So thank you, and thank you for that presentation.
Thank you.
So I don't really have questions since I work so intimately with this project, and I have to say this is really something I'm really proud of to see happening, and I hope your ears are burning, Sean and Erin as well. That I've been talking to all my colleagues, like in the fields and outside the field, both here nationally and also internationally, about this unique program, because it does not exist anywhere actually, like across the globe. And to see the kind of questions being generated like for these research, it just warms my heart, and I can tell you like how much I look forward, to really engage, these future scholars in their work, and and really appreciate the thoughtfulness that they put into this fellowship. So thank you so much for making this happen. I have not seen this like in my entire career of advocacy in the trans community. This is definitely the very first time, and it's historical and it's amazing.
Thank you so much, Cecilia. And I know that our audience here, if I might just leave you all with something to think about or a nugget to chew on, and then that is that it's so, I can't even tell you what it feels like or what it is to be a person who has to deal with one's own identity at multiple intersections of identity and then be called to that work, to be called to the work of community, to be called to that and still be in community is a heavy, heavy, heavy toll. And then when you think about that in an institution like academia, where there are rules that that shape how people talk to you, or how people talk to people in the community, not not thinking that you may be a part of that community, it puts a toll on you. And one of the things that we've created here is to create a space for not only for people to exist as themselves, but also to ask critical questions of the field, questions that may actually ruffle feathers, and also questions that need to be asked for accountability's sake. And so we're doing our best, and it's a pleasure to share that with you all, and we hope that we'll have many more exciting outcomes to share with you all in the future.
Keep up the good work.
Thank you so much. Thank you all.
Have a good day. Thank you again.
Thank you. My pleasure.
We can move on to item 4, the San Francisco Health Network update on program impacts of the 2016 Public Health and Safety Bond capital projects. And I'm going to share my screen as Dr. Hammer and Kathy Jung say hello.
I'll get us started. Good afternoon, commissioners, and thank you very much for inviting us to present to you updates on the 2016 Health and Safety Bond supported capital projects in ambulatory care, where these are such exciting projects, and it's really fun to show people the buildings and to talk about the project. So this is great. And before we start, I want to say a few things. First, Sean, I am completely inspired by your presentation. Shine strong. Wow. You got me. So I'm just really moved and just so inspired by what you all are doing and the mentorship and everything. So it's fantastic. I'm joined today by Kathy Jung, whom I think you both know. Kathy's the Director of Facilities and Capital Projects for the DPH and has been, I kind of think of Kathy as like my partner in crime. Like we've been working on this together for a long time, since my first weeks as Director of Primary Care, way back in whenever that was, 2014, and having and starting to think about what we could include on the 2016 bond that would really lead to meaningful improvements in the care that we can provide for our patients and clients, in the collaboration that's possible between primary care, ambulatory care, and other areas of the health network, especially behavioral health services. And then also, you know, so important is just the experience of working and providing care in beautiful state-of-the-art new facilities. So Kathy's really been the key leader in DPH, moving these projects forward, working across agencies, and just a lot of blood, sweat, and tears that goes into bringing these projects to fruition. And Kathy and her whole team have really been great partners. Also in the meeting today and available to answer questions if they come up for him is Bill Blum, who is from my team and has been our key point. Bill is the Director of HIV Health Services and Projects, now working ambulatory care wide, but has been the lead on the primary care executive team on facilities for many years. So it's great to have Bill here, and really appreciate his really on the ground, hands-on work, making sure our facilities facilitate good patient care and a good work experience. So you just recently had a presentation from Mark Primo about an update on the 2016 Public Health and Safety Bond. Today, we just really wanted to go a next level deeper and share with you the 4 ambulatory care sites that have been renovated or where we've built new buildings, and let you know what's going on with those and what we're planning for those beautiful new buildings. Next slide, please, Mark. The 4 projects which we'll talk about today are Maxine Hall Health Center, which is it's listed first here, but actually I should mention that our first big project funded by the 2016 bond is an amazing renovation of Southeast Health Center's dental clinic. It's just gorgeous. We should have listed it here, but we opened that clinic, I believe, in 2019, not long before COVID hit. And so that was the first thing we did. And then these 4 health center projects. So Maxine Hall Health Center, which we moved back into a renovated building in October of last year. We just last month moved into our brand new building at Southeast Family Health Center. It also got a new name, and I should have updated the slides. Castro Mission Health Center. So the team this week is madly packing things up and moving from their temporary space at Zuckerberg San Francisco General and moving into their beautifully renovated building later this month. And then the last project is the Maria X. Martinez Health Resource Center, which will be opening in October of this year. And then I'll just mention at the end a little bit about the work going on at Csfg. That's also part of the 2016 Public Health and Safety Bond initiatives. Next slide, please. So Maxine Hall Health Center, and as I go through these, I hope you're just itching to go actually walk through these buildings and take a look. I think it would be really fun to take a tour of all 4 of these spaces, probably when they're open, because it's a little easier on the facilities team for us to just show up when the buildings are open. But I'd love to walk you through and show you the spaces. So Maxine Health Center is our health center number 2. Number 1 is Castro Mission, which you'll hear about next. Maxine Hall is Health Center number 2. It is in the Western Addition and has been, one of our shining star community-based, community responsive health centers since it opened in, I'm forgetting what year Maxine Hall first opened. I'm going to guess at 1969 or 1970 maybe. But back then, Maxine Hall serves residents of the Western Addition and Panhandle, Fillmore area. It has developed programs to specifically serve the health needs of Black and African American people who call Maxine Hall their medical home. It's Maxine Hall is co-located with the West Side Methadone Clinic, which is run by our partner CBO. And Maxine Hall is a 2-story building that for a long time had no elevator, and most of the and the behavioral health services, the integrated behavioral health services, were on the 2nd floor, as well as a lot of the offices and common spaces. So it was not accessible by any measure, and so our primary in terms of construction goal was to make sure that we had an elevator and that patients and staff, community members could access both the 1st and 2nd floor. So Maxine, you're going to see these little schematics of the new building design, but nice, big, welcoming registration area on the 1st floor, along with some clinic rooms, some office spaces. And then on the 2nd floor, we have most of the exam rooms. This was a $18.7 million project, Maxine Hall. And I should have said this at the beginning. Maxine Hall serves about 3,500 active patients, so people who have been to Maxine Hall and have that as their medical home. About 6,000 total assigned patients. And so the next slide, is Southeast Health Center. That's, as I mentioned, we had a really exciting ribbon cutting with Mayor Breed and President of the Board of Supervisors Walton, along with Grant and a number of people who are part of Southeast Community Board. We had that last month. Really exciting. Southeast again is a brand new building. So you see in that picture on the bottom, the new building is the 2-story building on the right, and the existing building is the 1-story brown building on the left. We're still using the existing building for, as I mentioned, dental services and some offices. And then also really exciting is that one of the specialty mental health services, so the mental health teams, Southeast Children and Family Therapy, will be moving into that existing building and co-locating with the primary care clinic at Southeast Family Health Center. So really, really exciting to bring specialty CYF services to that phenomenal new campus, really, where we provide dental services, primary care, non-specialty integrated mental health services, now a specialty CYF team. We have a food pharmacy there. We have an eye clinic, so we'll have an optometrist from Zuckerberg San Francisco General be seeing patients on site. We have just a really great, well-rounded, full-service primary care clinic there, and with a co-located specialty mental health. The thing that I want to just point out to you on this slide is that one of the things that we spent a lot of time on in the planning process was really figuring out what our clinical model is in terms of the layout of the space. And as you can see there, those orange, the orange areas on this, let's see, I'm orienting myself. So the orange areas are the workspaces. The yellow boxes are the exam rooms, and also the those hallways you see on either side. And we went to visit a number of different primary care sites all over the place, and decided on this particular model that we have now at all of these new clinics to some extent. But Southeast is a great example of that. So so there on the, just a little turn around, where's the elevator? Okay, so there on the right side, is it the right or the left, Kathy, the big windows? Anyway, one whole wall of the patient's walkway is windows. There's a beautiful window looking out over the MLK Park and out over the looking west out on the city. And so the patients walk up the hallway and then go through a door right into a open, spacious exam room or a behavioral health consultation room. The room exactly opposite has another doorway, which is accessed by the care team, by the provider, by the nurse, by the medical assistant. And then there in that middle space, the teams, those care teams have workstations where they work together. They can talk between patients or do some charting. So it's a really nice layout. And it allows us to have team workspaces right in the middle of the clinic, which is really nice, as well as much more efficient patient flow. So that's Southeast Health Center. Southeast Health Center, again, building a brand new building. That was a $39.5 million project, and Southeast serves about 5,000 active patients with about 8,000 people assigned to Southeast Health Center as their medical home. So really nice that this new building allows us some room to grow our primary care services. The other thing that we've really tried to do at Southeast is to bring specialty care to Southeast. So I've already mentioned dental, optometry, but we've also had high-risk OB, so obstetricians come out from the general to have regular clinics at Southeast Health Center so that people don't have to always go to the general all the way across town to access their specialty services. We've had cardiology, we've had people from chest clinics, so pulmonology out there. And yeah, that's been a really nice collaboration. Oh, and geriatrics. So we've had a geriatrician who regularly sees patients out at Southeast Health Center. Okay, next slide. So our third primary care clinic is Castro Mission Health Center. Castro Mission is health center number 1, opened in 1965. Has been another really shining star in terms of community responsive health center that pivoted to meet the needs of Castro's gay community when HIV hit, and then has also traditionally had almost completely bilingual staff serving the Spanish-speaking neighbors from the mission. And Castro Mission has also historically had embedded specialty mental health services. We have a very robust behavioral health team at Castro Mission Health Center. And yeah, so the project at Castro Mission was to take the second floor, which when I think back to the second floor before the renovation, it was like, you know, you'd walk into a room, it's just full of boxes and old broken furniture and chairs. And like, so maybe you could find the conference room, but it was like in the middle of just really a rundown building with most of the patient services on the first floor. So now, again, you'll see this similar layout, so that of the room layout that you see there. Most of the primary care services will be on the second floor. So you see those exam rooms there, and then a number of consultation rooms for our integrated behavioral health teams. We also have on the first floor, we're very excited that we have a new co-location with a behavioral health services team, which is Gender Health San Francisco. Gender Health has been, for the last maybe 4 or 5 years, been located at Csfg, which seemed ideal at one point because they work with a lot of people who are meeting with specialty services at the hospital, because they support people when they're having gender-affirming surgery or seeking gender-affirming care at the general. But now with this newly renovated Castro Mission Health Center, which is not that far from the hospital, Gender Health really realized that they wanted to be more closely integrated with a primary care clinic. And so they'll be there on the first floor in really nicely renovated offices. There's sort of a whole suite, which will be for Gender Health SF. And Castro Mission, so we don't have a dental clinic at Castro Mission. As I've talked about, we have integrated behavioral health. Castro Mission is also, one of Castro Mission's special programs is called Dimensions, which is our sort of whole person approach to care for adolescents and transitional age youth, youth experiencing homelessness. Their primary population is trans and gender non-binary youth, but this is a program that's located and has always been fully embedded in Castro Mission. So they go through the same registration processes and the same staff who serve the general population in Castro Mission. Also work with Dimensions when Dimensions is open. I think it's still 2 half days a week, Saturdays and 1 afternoon, evening a week. So in answer to your question, Commissioner, Dimensions has always been with Castro Mission. So Castro Mission's temporary spot at Building 80 at Csfg. Dimensions is there. They've been seeing Dimensions patients there the whole time while they've been out of their building. Gender Health SF, on the other hand, is a brand new co-location. So Gender Health will move to Castro Mission, we think, next month. So this month we'll move the whole clinic, and then Gender Health will move over soon thereafter. All right, next slide. All right, Maria X. So this is the Maria X Martinez Health Resource Center. We are so incredibly excited about this new center. I think you've heard us talk about the Maria X, which is kind of what we're calling it, named for our dear colleague Maria X Martinez, who passed away a couple years ago and did a number of things in the DPH through her incredible career. But her last position with the DPH was the Director of Whole Person Care, which was a 5-year-long state waiver program where we chose a population of focus. We worked with adults experiencing chronic homelessness and teamed up with HSH, with HSA, and really formed this new approach to caring for adults experiencing homelessness, which was a whole person approach. So integrating specialty and non-specialty mental health services, dental services, and linking, and for people who are who enter care seeking medical services, also offering them linkages to obviously behavioral health, but also linking them to benefits, to signing up for benefits, to going through the coordinated entry process in order to get housing. We have had an increasingly busy urgent care clinic that's part of our whole person integrated care service in the basement of 101 Grove. And 6 years or so ago, when we were just starting out the whole person care work with HSA and HSH, we had this idea that we had to move urgent care. I think Kathy found that parking lot, or maybe it wasn't you, Kathy, but I remember hearing the idea from you first. Parking lot adjacent to the federal building at 7th and Mission, and we were able to lease that building from the federal government, and then working with HSH, with Mercy Housing, with Episcopal Community Services, and MoCD, we're able to build a brand new building. Most of the building is 250 units of new supportive housing. There's also vocational development programs there. And then in the back of the building, so on Stevenson Alley, we have our brand new clinic, which is the Maria X. So urgent care at 101 Grove will be moving, and we'll be moving it, and we'll be opening this new urgent care and transitional primary care clinic for people experiencing homelessness. It'll have a large, new, beautiful dental clinic. The dental clinic downstairs at 101 Grove is, one of the just really not conducive to great patient care. It's in a small, dark, not great space. And so we're really, really excited to have the state-of-the-art new dental clinic there. Integrated behavioral health, podiatry, pharmacy. So just really excited about this new space. The space will also house staff from HSH, from the Homelessness and Supportive Housing Department, who are part of the SF HOT team, who we work closely with, the Homeless Outreach team. And we'll also have staff on site who can, again, with this whole person care vision, be able to help people sign up for benefits, sign up for, go through the coordinated entry process. So really, really looking forward to moving into the Maria X in a couple months.
Hallie, I don't know if
yeah.
you said it, but street medicine will be housed here.
Oh yeah, street medicine, which now is sort of integrated with urgent care and our homeless outreach clinic. Our current little tiny space downstairs, our urgent care clinic and our open access clinic serve about 5,000 people a year in 18,000 visits. It's very, very busy. We've gone in the last few years from seeing 30, 40 people a day to seeing 70 or 80 people a day. So it's gotten very, very busy. Next slide, just want to, and here pictured is Dr. Barry Zevin, who I think most people know, but really Barry's vision of how you provide episodic, so urgent care to people experiencing homelessness in a welcoming, barrier-free, really human-centered, person-centered environment, and that's what I think we're going to finally see at the Maria X when we open. Next slide. This slide just gives you some details, just an update on the bond-funded projects that are going on at Csfg. I'm not going to spend much time on that, but you can read through those. In my neck of the woods, what we're really excited about is the 5th floor of the old building. The old hospital building, Building 5, will be renovated to be a really beautiful state-of-the-art primary care clinic for our Family Health Center, which is our largest clinic in primary care, and Richard Fine People's Clinic, which is another large, really incredible academic health center. So those will both be on the 5th floor, and then we'll also be moving our positive health program, Ward 86, from Building 80 over into the renovated space in Building 5. Yeah, so it'll be a really exciting, vibrant ambulatory care center in that old hospital building. Along with, as you can see, a lot of other renovations going on in that building, a lot of other projects. Next slide. So we're done, but I just wanted to, this was my reminder, thanks Kathy, to remind people that, so this is about the Chinatown, CCDC Chinatown Child Development Center. They're coming up on their 50th anniversary. So there's a big celebration for them, but this is also in here because we're really looking forward to being able to achieve another huge co-location project, which would be moving CCDC into our Chinatown Public Health Center building, if we're able to pass the next, what is it, 2024 bond?
2020,
Um,
November
Kath-
2023 is the next Department of Public Health GO bond.
Right, and so the renovation of Chinatown Public Health Center in co-location with CCDC would be our main ambulatory care project on that bond. Kathy, anything else to add in? Anything I left out?
No, I think you covered it. So yes, I just want to pitch the Chinatown. We are working on Chinatown now very aggressively to get through construction documents in preparation for the ballot. Hopefully we will have 100% documents done, so it'll be a good sell. Hey, so vote yes, and we'll be in the ground in 6 months, which is pretty amazing. So that's a really exciting project. We've learned a lot from the other 4 projects, and it's going to be great to incorporate the CCDC, the Chinatown Child Development Center here. And I just want to clarify on the Maria X Martinez. The project was actually a mayor's office and housing community development site that the city picked up the federal parking lots that were put up. And under federal law, they first have to be offered to anybody who would want to put homeless facing services on the sites. And so the city grabbed it, and we were able to get into the project and do our clinic. There's some community space there. So we were very fortunate. The city was very supportive to work with that. And it's gorgeous. You really do need to look at some of these clinics where it's amazing. And Hallie alluded to the dental clinic. I think she was kinder about her description of the dental clinic than it really is. The new clinic is like a private, walking into it. And it's so great for the patients. We're really excited to open those doors.
Thanks, Kathy. Yeah, thanks for setting the record straight on the
Just wanted to-
how we got that space down in Soma. So thanks. And we are happy to answer questions.
Commissioners, there's nobody on the public comment line, but I'd like to make a clarification just around tours to Dr. Hammer and Kathy, that because of sunshine laws, the commission has to be very careful with doing tours. So like if the two in this committee went, it would constitute a meeting. So we can certainly arrange that. But it would have to be a bit of a deal, to maybe do 2 at a time in configurations that aren't a committee in the future. But let's keep that as a thought.
Thanks, Mark.
Thanks, Mark. I knew there was a reason that we hadn't already planned that. We're actually having our integrated steering committee meeting there at Southeast Family Health Center next Monday. But thanks for that reminder. Sorry about that.
And it's definitely possible. It just takes a little bit of planning. So, commissioners, any questions or comments from you?
I think Commissioner Chung has a question, but she's muted.
Commissioner Chung, go ahead. Oh, no. You're unmuted, but your sound isn't working. Okay.
Okay, I have a question until she's got sound.
Do you want to go ahead? It looks like she's off camera
She's
now.
trying to log back in. Yes, cyberspace is great. My question, thank you so much for this wonderful presentation. Again, I learned a lot. My question with Southeast health center since it's a brand new building. And I know and have worked very closely with the behavioral health children and adolescent services since you've got more room. Are you going to be able to increase the services at all within that area?
So the plan is to, and I always get the name of the clinic wrong, so Hallie help me. It's the Southeast,
Southeast Children and Family Therapy Center.
which is currently located on Blanken Street, will be moved over to South, and they will be expanding services. They want to expand services to the caregivers of their clients. And so there's other opportunities. So we're looking at that now and how that could obviously take on more in the future. So when that opportunity comes up, but we are planning the space and hopefully we'll move in the next year or so. Right. So construction starts sometime next year.
Okay, so currently they're still in the older build into the original building?
There, the clinic?
Yeah.
Yeah, the clinic is actually located in a leased property on Blanken Street. And
Oh,
so,
it is.
yeah,
That's
so we'll
okay.
be moving them over to be closer to primary care, so there's greater integration of the services.
So that'll be in a year.
Construction will start within a year, so it just depends. It will be done by the Department of Public Works, and we're working on the programming right now, so to adapt the building.
Just to be clear on the program side, Commissioner Jurado, is that we have integrated behavioral health in all of our primary care clinics, right? So we have behavioral health clinicians and behavioral assistants who are right there, same hallways, part of the care team there all the time. We can do warm handoffs. I mean, our real, but we have to refer out for specialty mental health services. So normally in order for me as a primary care doc to get one of my families or my kids into Southeast Children and Family Therapies, I would have to send them to our behavioral health clinician who would then refer them to especially mental health. I think what this co-location sort of opens the door up for is really true integration, collaboration. So can we have special days of the week where we actually have the behavioral health team in the primary care space, like with us, seeing patients together? I think there's a lot of possibility for that. I mean, the newly renovated spaces have these large, beautiful family consultation rooms. So I think it just gives us a lot of possibilities.
Okay, thank you for helping clarify it. It's just, I know the services that I've referred to and collaborated with have always been excellent, as well as the trainees that have come through that program. So that's where I was trying to understand the integration of the programs. So I appreciate it.
I think Kathy was going to add something. I mean, to start, we're really talking co-location because they'll be moving over to the same campus. But I think it does put the groundwork down for us to really integrate our services more.
I was just going to add that in remodeling Maxine, Castro, and Southeast Health Center, we really looked at creating family therapy group rooms, right, which really haven't existed in the past, and giving consult rooms that are integrated directly for the primary care behavioral health providers on site integration. So the collaborative work areas that Hallie was describing, that everybody will sit together and be able to, communicate about patients, and the warm handoffs will be so much easier. So if somebody they're seeing in primary care, as I understand it, if there's a clinician available, oh, wait a minute, so-and-so's here, maybe we can get you over here to see somebody. So it's all just so integrated together. The model was intended that way, to offer up spaces for consultation and group rooms. Right.
Great.
Yeah.
Thank you. Then I just have one other comment about CCDC, and for the next, try to push on the bond issue. I have worked very closely with CCDC over the last number of years, And I'm encouraging you and the DPH team not to be shy about really kind of tooting your horn, so to speak, in your push for this and some really good sound bites, because the work is excellent and very, very essential to the community. And oftentimes, at least DPH doesn't pat themselves on the back and really be able to stand out. So I am just highly encouraging you to please do so, because I've worked very closely clinically with the team over a number of years, and they're essential. And I'm just hoping the co-location then will work and be able to be approved. But you need to kind of really, shout yourselves out and not be shy about it.
So we are moving towards having our first community outreach meeting about the project. And so, we would hope that CCDC will take an integral role and leadership role in pulling that together, because we do understand their value and their relationship to community, the Chinatown community. And so we've worked exceedingly closely with them on the development of the space every inch of the way. So it's been fun. They know what they're doing. It's exciting. And yeah, so take your words at heart that we'll look to promote.
Please do so, because we have a developmental and behavioral clinic at NEMS, and we really partner with CCDC. So I really, encourage that. So
Yeah,
thank
I couldn't agree more, Supervisor Jurado. I've had a number of patients who have been under who've gone to CCDC over the years, either through school connections or just through our referrals, and they do tremendous work. So I totally agree that we gotta be out front and center and make sure that bond passes and we can move forward with the project.
Good. Thank you.
Thank you.
Commissioner Chung? I'm sorry we're not able to hear you. Commissioner Chung, would you like to call me and ask me the question or something, and I can put the phone up to the speaker? Can you call my cell phone?
It's funny because we could hear you before.
Yeah.
Right, but for the purpose of this meeting, go ahead and call my cell phone, and I can put the cell phone up to the thing. Cell phone. Okay. Sorry, but thanks for your patience, everyone. Okay, so I'm gonna put the phone down on the speaker and let's see how it works. Hold on, let me put the speaker on speaker. Yes, try that.
Can you hear me now?
Can you all hear her? Yes, please go ahead.
Okay, so I have two parts to this. I'm glad to hear that gender health is moving to different locations. Only because I know that the current locations doesn't have natural light, and and changing that is kind of like helps improve the conditions for the staff. And also because gender health clinic is not a primary care clinic, so this might actually encourage the patients, like to choose Castro Mission as their primary care providers, and by doing so, you're creating a medical home model. So glad to hear that.
Commissioner Chung, I couldn't agree more. I mean, I think that's the opportunity we have with all of these co-locations is really just to provide better care for individuals and families, especially those like our clients at Gender Health SF who seek out our very specialized programs, but who also need access to full scope primary care. And I really hope that I mean, Castro Mission has historically had medical providers and as well as nurses whose special, area of interest includes trans care. But I think this will just give us, more sort of access to in terms of making sure gender health clients have, are getting the primary care they need as well. So that should be great. I'm really looking forward to it.
Yeah, I'm curious also because this is kind of prehistoric. I used to be a HIV test counselor, and Pastoral Mission was one of the sites we used when the regular clinic closes. And I wonder if they still have that HIV testing services.
At Castro Mission.
Well, that is a really good question. I mean, we certainly do a lot of HIV testing at Castro Mission, but I don't think we have a dedicated HIV test service that would be outside of the medical home. So in general, just like pre-COVID vaccinations, TB tests, HIV tests, we really provide those services for our medical home patients. But I could be wrong. And now, I should have remembered that Bill Blum is on, so maybe he can answer that. Did we get rid of that, Bill?
Yeah, so the tests are offered on demand, and it's part of at least a screening for all the primary care providers when folks initially come in, and then as people they do as much as they can kind of regular STI screening. So folks that are sexually active in ways that may put them at risk for acquiring HIV do get tested. But the majority of testing, which is funded by CDC through prevention dollars, goes through CHEP. And it's really moved to a lot of community-based testing. So I would describe HIV testing as not clinic specific, but pretty endemic in all the primary care services at Castro Mission. And Tracy Packer and her new folks coming in could give you guys a lot more information if you wanted.
Isn't Tracy retiring?
She's actually
She's still working 1 day a week, but her staff, Naisha or Nicole, could probably fill you in, or Thomas Noble.
Okay, well, that's good to hear. Yeah,
I think there's a lot. It's kind of become standard of care now, so I think you'd find doctors routinely offering it.
Yeah, I think that the reason why I ask is it's less of an issue now, because back then I was talking about like anonymous testing, which was done by HE, and yeah, they changed the name to Alliance Health now anyway.
Yeah, very limited anonymous testing available, and of course, across the street and down the block is Strut, so that's another source of HIV testing. San Francisco AIDS Foundation's clinic, right on the corner of Market and Castro.
It's great, thank you. It makes me feel old though.
We can't help you with that one. All right, thank you very much, everyone, for that the presentation and all the great responses. And commissioners, I also will talk to leadership around when Mark Primo and his team present public health and safety bond updates. If you all want to include these service updates, because it seems like it makes it much more robust. It makes it come alive more than just seeing the construction and all the buildings. I'm seeing you all much more animated around that. So I'll take that as a recommendation or ask. Item 5 is emerging issues. Anything from you, commissioners? Okay. Item 6 is public comment, and there's nobody on the line, so we can move on to a consideration for adjournment.
I so move to adjourn the committee meeting and thank our presenters for their excellent and informative presentations.
I'll note that Commissioner Chung is not able to respond because of technical difficulties, but she's seconding, which means that the meeting is adjourned, and hopefully that can be rectified by the next meeting. And thank you, everyone, for a great meeting.
Thank you.
And commissioners, please read your emails. I've sent you a couple updates during the meeting that it'd be helpful if you read before the full commission meeting. All right, bye-bye.